Hi, Mark here again with another recap of our training. There are several types of anxiety and they're not all the same. You could be faced with any of them in a work environment, but by far the most common will be a generalized anxiety with excessive, uncontrollable and often irrational worrying about something like an event or a work-related activity. What we might call the what-if scenario, where we imagine every possible outcome. There's a famous quote attributed to many famous people over the years that says, "I have lived a life of angst and turmoil, 9/10 of which never happened." Social anxiety is usually about having an over-the-top fear of speaking in public or presenting at a conference or attending a work function. Normal fear around this is fine, but some have a debilitating fear. Even if signing one's name in public can trigger an episode. And possibly panic attacks. Again, not as common as generalized anxiety, but can be terrifying when in the throes of one. A person can feel like they're going to die, have a heart attack, or even faint, which won't happen, as fainting requires a sudden drop in blood pressure, and a panic attack is usually off in the other direction. The typical signs for an individual would be heart racing, racing thoughts, mood swings, feeling judged and being noticed, or maybe sweating, poor sleep, etc. What an observer might notice is blushing or sweating. They don't seem to be concentrating, or maybe hearing you perhaps. Going pale, fidgety and energized, tired and drawn, perhaps being defensive when in conversations. So it's important how we approach the person to check in with them, as it needs to be in a way that doesn't exacerbate their anxiety. And it's a private, quiet interaction. Most definitely not a spectator sport. So pick your moment, go gently.